government of Nigeria, on behalf of the good people of Ugunabo, declare this specialist multipurpose hospital built by the Sustainable Development Goals of the Federal Republic of Nigeria. I hereby declare it open in the name of the Father, the Son, and the Holy Spirit.
The governor of Abia State, Dr. Gov.Otti, has commissioned the 100-bedded Sustainable Development Multipurpose Hospital, Abia, in Ugunabo local government area, built by the federal government under the Sustainable Development Goals (SDGs). Speaking while performing the ceremony, Governor Otti thanked President Bola Ahmed Tinubu for his commitment to the healthcare sector, which saw the completion of the project as well as the renaming of the SDG Mother and Child Hospital to a multi-purpose hospital to accommodate other members of the society. Governor Otti, while emphasizing the importance of healthcare in his administration's strategic agenda, highlighted the 2001 Abuja Declaration, in which other African countries pledged to allocate at least 15% of their annual budgets to healthcare, pointing out that Abia State's 2024 budget has met the targets. He stated that the goal of his administration for the health sector is in alignment with the federal government's Sustainable Development Goal 3, which aims at reducing maternal mortality to 70 per 1,000 live births by 2030. The state governor noted that the state has made significant progress in maternal health, with the state's maternal mortality rate dropping from 147 per 1,000 in 2020 to 521 in 2022 and further to 136 in recent reports.
Your Excellency, I'm happy to report that the current 2024 budget of the Abia State government, which we are halfway in implementing, allocated 15% of the budget to healthcare. So what you have done here is consistent with the objective of this government. And I want to thank you for also calling our attention to some of the sustainable development goals, particularly the SDG 3, which targets to reduce maternal mortality to 70 per 100,000 by the year 2030.
The state chief executive unveiled plans to develop a medical village in the state to curb the medical tourism, which costs Nigerians between $1.6 billion to $2 billion annually. Governor Otti, who assured that the state government would assume the management of the newly commissioned hospital, promised 24-hour security, additional land for the building of doctors' quarters, and the establishment of a facility management team to maintain high standards.
But this government is very deliberate and intentional about focus on healthcare delivery. It is also our intention that by the time this administration will be winding down, that will be handing over to posterity a medical village where everything at all that you need to think about will be available. Statistics says that anywhere between $1.6 billion and $2 billion as at 2021 was being spent on medical tourism by our people. That's a large amount of money. And the major beneficiaries are India and Dubai, and then of course Europe and America. Our goal is that by the time we finish with our medical village, we are not greedy, at least 10% of $2 billion, which will be $200 million, will be spent in Abia State.
In an address, the wife of the governor, Mrs. Priscilla Otti, represented by the wife of the deputy governor, Mrs. Adaeze Emetu, said that the realization of the project is part of the unwavering commitment of government in providing quality and accessible health care for all.
We must recognize the pivotal role of maternal health care in fostering a healthier and more prosperous society. Pregnancy is a delicate phase, and it is imperative for expectant mothers to attend regular antenatal and postnatal care. These routine checkups monitor the well-being of both the mother and the child, providing essential information and support for a healthy pregnancy and childbirth.
In her remarks, the Senior Special Assistant to the President on Sustainable Development Goals, Princess Adejoke Adefulire, noted that the project, conceived in her first tenure under the former President Muhammadu Buhari, has come to fulfill the dream of every mother for a safe delivery in a healthy and conducive environment. She said that similar projects have been executed across the 36 states of the Federation under the Sustainable Development Goals to promote the standard of living, adding that the project is in line with the renewed hope agenda of the President Bola Ahmed Tinubu's administration, with commitment to prioritizing key interventions with multiplier effects on multi-dimension poverty.
So the sustainable development goals that Nigeria government committed to is for all of us, it's for our good, and it will be achieved by the 3 tiers of government, both the federal government, the state government, and the local government. In line with the President Bola Ahmed Tinubu JCFR, the New Hope agenda, we are committed to prioritizing the intervention with multiplier effect on multi-dimension poverty. The governor has asked me to thank you for your understanding and to thank you for the support you have for the country and for your state. He has asked me that very, very soon it will be better and better and better.
In an address, the Permanent Secretary, State Ministry of Health, Dr. Ifeyinwa Blossom Omakalu, said the hospital was established to serve the community without limitations as women and children bear the brunt of failed system. She appreciated Governor Otti for changing the narratives in the healthcare services and described the project as another milestone towards achieving a sustainable and efficient healthcare services in the healthcare ecosystem of the state. Also speaking, the Chief Executive Officer, Hospital Management Board, Dr. Odochi Azubike, said the Governor Otti's commitment to healthcare of the people led to the completion of the long-abandoned project in partnership with the Office of the Senior Special Assistant to the President on Sustainable Development Goals, MDGs. She said that the idea of establishing the facility is to achieve one of the Millennium Development Goals, which is ensuring health care for mother and child, adding that the facility is fully equipped to provide antenatal care, management of child diseases, and general medical services.